There have been significant improvements in the performance of the NHS across the UK. That's according to a major study which says the gap between England and the other nations is narrowing. The NHS in England still rates highly on ambulance response times as well as life expectancy. But Scotland has seen improvements in waiting times, while in Northern Ireland, deaths from MRSA have fallen. Waiting times are a persistent problem in Wales, though satisfaction among many patients is high. The report's authors suggest that funding and targets were the biggest factors in driving up standards, as Dominic Hughes reports.
The 15 years since devolution have seen four very distinct health systems evolve in the UK. There was sustained investment across the NHS, but now austerity is biting. No more so than in Wales. Satisfaction with the Welsh NHS is the highest in the UK, but recent budget cuts here have seen waiting times increase. Athena Williams, an NHS nurse for 4 decades, was told she might not get a hip replacement for a year and a half. Facing months of pain, she chose to go private.
As far as I was concerned, I thought the NHS was there for everybody who lived in the United Kingdom. It wasn't meant to be a two-tier system. So if you needed treatment, then you should get the treatment.
Compare the situation in England, where the NHS is built around competition, patient choice and targets. In the early 1990s, life expectancy here in the northeast of England was pretty much the same as it was in Scotland. But after a couple of decades of fairly heavy investment in the local health service, the region has started to pull ahead. So now people here can expect to live up to a year longer than their Scottish neighbours just north of the border.
Hi Rose, can we have a chat? Yes.
And this is the kind of thing that makes a difference. At Wansbeck Hospital in Northumberland, Rose Frosdick was operated on within hours of breaking her hip. She hopes to be going home any day. Getting patients back home quickly improves their chances of a good recovery, but it's required an injection of cash across the system.
The investment we've seen over the last few decades has been incredibly important in terms of patient care from a quality, safety perspective, and it's something we've seen right across the board from general practice into hospital care and community services, so very important indeed.
In Scotland, politicians rejected competition in the health service, but some targets have been used to bring down waiting times. But all across the UK, the NHS faces the challenge of older patients, tighter budgets and greater expectations. In Northern Ireland, devolution means local politicians have to sell the reform of the health service to their own electorate.
The reality is the system that we have is not sustainable. It requires huge change, transformation in order to make it fit for the 21st century. Our politicians and our media have to ensure that the public believe that and understand it and are fully committed to it.
For all the differences in how the four health services are run and organised, today's research suggests it's the funding of the NHS and a few carefully chosen targets that are the key factors in how well it works. Dominic Hughes, BBC News, Newcastle.